Welcome to the Victory Education Lounge. I'm your host, and today we're exploring a fascinating and often overlooked topic: dermatological issues, skin conditions, and insulin resistance. This is part 89 of our ongoing series on metabolic health. Before we dive in, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Have you ever considered that your mental health can be influenced by something as seemingly unrelated as insulin resistance? It's a curious thought, isn't it? But the truth is, our bodies are incredibly complex systems where everything is interconnected. Insulin resistance, a condition in which the body's cells don't respond properly to insulin, can lead to higher blood sugar levels. This might sound like it's purely a physical issue, but the ripple effects can reach far beyond that. The mismanagement of insulin in our bodies can influence our mood, energy levels, and overall mental well-being. It's a surprising connection, but one that's increasingly being recognized in the medical field. So, in today's episode, we're going to explore this intriguing intersection of metabolic and mental health. We'll delve into the science, the symptoms, and the solutions. Stay tuned as we delve deeper into the connection between mental health and insulin resistance. Insulin resistance, quite simply, is when your body's cells stop responding to insulin as they should. Now, you might be wondering, what exactly is insulin? Well, it's a hormone produced by the pancreas that plays a crucial role in our bodies. It allows our cells to take in glucose, the primary source of energy, from the bloodstream. When you eat, your body breaks down the carbohydrates in your food into glucose, which then raises your blood sugar levels. In response, your pancreas releases insulin to help your cells absorb this glucose and put it to work. However, when insulin resistance occurs, the cells in your body become less responsive to insulin. They struggle to take in glucose, causing it to build up in your bloodstream. As a result, your pancreas has to work overtime, producing even more insulin in an attempt to get your cells to respond. Over time, this can lead to higher levels of insulin circulating in your body, a condition known as hyperinsulinemia. This cycle of insulin resistance and hyperinsulinemia can have serious implications for your health. For starters, it's a significant risk factor for developing type 2 diabetes, a chronic condition that affects millions of people worldwide. Additionally, it can contribute to heart disease, as high levels of insulin can cause your arteries to harden and narrow. Insulin resistance doesn't just impact your physical health, it can also have profound effects on your mental well-being. Research has shown a connection between insulin resistance and neurological conditions like Alzheimer's disease. It's also been linked to mood disorders like depression and anxiety, which we'll delve into more in the next segment. Moreover, insulin resistance often goes hand in hand with other metabolic issues, such as obesity and metabolic syndrome. These conditions can further exacerbate the health risks associated with insulin resistance, leading to a vicious cycle of declining health. But how does this relate to mental health? Let's explore. Surprising as it may seem, insulin resistance can directly impact your mental health. Let's delve into this connection and explore how this metabolic issue can influence our mental well-being. Insulin resistance, in essence, is when our body's cells become less responsive to insulin, the hormone responsible for regulating sugar levels in our blood. This leads to high blood sugar levels, which can have far-reaching effects on our body, including our brain. Our brain, interestingly, is a heavy consumer of glucose, the sugar that insulin helps to regulate. When insulin resistance occurs, the brain may not get the glucose it needs to function optimally, influencing our mood, cognition, and overall mental health. Consider the case of Jane. Jane is a 45-year-old woman who was diagnosed with insulin resistance. She noticed that she was feeling constantly fatigued, had difficulty concentrating, and was more irritable than usual. These are all symptoms that we typically associate with mental health issues, such as depression and anxiety. In fact, research has shown that insulin resistance can increase the risk of developing these disorders. Another example is Tom, a 30-year-old man who was struggling with anxiety. His anxiety seemed to worsen after meals, particularly meals high in sugar. When he was diagnosed with insulin resistance, it became clear that his blood sugar fluctuations were exacerbating his anxiety symptoms. These cases highlight the profound impact that insulin resistance can have on mental health. Our bodies are complex systems where one issue can cascade and affect other aspects of our health. It's not just about high blood sugar or potential diabetes down the line, it's about our mood, our ability to think clearly, and our overall quality of life. As we can see, the effects of insulin resistance extend far beyond just physical health. In our next scene, we will delve deeper into the specific impacts on anxiety and depression, and discuss strategies for prevention and management. Two of the most common mental health conditions, anxiety and depression, can be significantly influenced by insulin resistance. Let's delve into this connection a bit deeper. Insulin resistance, as you may remember from our previous discussions, is a state where the body's cells fail to respond adequately to insulin, resulting in high blood sugar levels. This metabolic disorder can have far-reaching effects, and mental health is no exception. Anxiety and depression are characterized by feelings of intense worry, sadness, and a lack of interest in daily activities. Now, imagine adding the physical burden of insulin resistance to this mix. The body, already struggling to maintain balance, can exacerbate these mental health conditions. Consider the case of Emily, a 30-year-old woman who had been dealing with anxiety for years. After being diagnosed with insulin resistance, she noticed her anxiety symptoms intensifying. She felt tired all the time, her concentration waned, and her anxiety attacks became more frequent. Similarly, take the example of Mark, a 45-year-old man who had been battling depression. When he was diagnosed with insulin resistance, his depressive episodes became more severe, and his energy levels dropped dramatically. In both these cases, the common thread is insulin resistance. The metabolic imbalance caused by this condition can lead to an increase in cortisol, the body's main stress hormone, leading to heightened anxiety. Similarly, insulin resistance can affect the brain's neurotransmitters like serotonin, which can worsen depression symptoms. The experiences of Emily and Mark highlight how insulin resistance can add another layer of complexity to managing mental health conditions. It's not just about feeling anxious or depressed, it's about dealing with the physical manifestations of a metabolic disorder that can intensify these feelings. So it's crucial to understand that the battle against mental health conditions like anxiety and depression isn't just fought in the mind. It's also fought in the body, in the cells that may not be responding well to insulin. Insulin resistance is not just about physical health, it's a mental health issue too. Understanding this connection can help pave the way for more comprehensive and effective treatment strategies. The good news is, there are ways to manage insulin resistance and in turn improve your mental health. It's like hitting two birds with one stone. First off, lifestyle changes can work wonders. Adopting a balanced diet rich in whole foods and low in processed sugars can help regulate your insulin levels. Regular physical activity, even moderate exercise like brisk walking, can also improve insulin sensitivity. It's not just about reaching a certain weight, but about fostering a lifestyle of wellness. Next, medical interventions may be necessary. Your healthcare provider might recommend medication like metformin to help manage insulin levels. This is often used alongside lifestyle modifications for maximum effect. Now, stress management is an underestimated tool in the arsenal against insulin resistance. Chronic stress can wreak havoc on your body and contribute to insulin resistance. Mindfulness practices such as yoga, meditation, and deep breathing exercises can help reduce stress and enhance your overall well-being. Sleep is another critical factor. Lack of quality sleep can increase insulin resistance. Make sure you're getting enough rest and maintaining a regular sleep schedule. Last but not least, regular checkups are essential. Regular monitoring of your blood sugar levels can help track your progress and adjust your management strategies as needed. Now here's the bonus. As you take these steps to manage insulin resistance, you'll likely see improvements in your mental health too. Regular exercise, it's known to boost mood and reduce anxiety. A balanced diet, it can stabilize your mood swings. Stress management and quality sleep, they're essential for mental health. And let's not forget the power of regular health checkups. They can provide reassurance and timely intervention, reducing anxiety and stress about health issues. So you see, the journey to managing insulin resistance is a holistic one. It's about taking care of your body, but equally about nurturing your mind. Remember, taking care of your physical health is a vital part of supporting your mental well-being. We've covered a lot today, from the basics of insulin resistance to its impact on mental health. We've delved into how our bodies react when they don't respond effectively to insulin, leading to high blood sugar levels that can affect our mental state. We've also explored the various skin conditions that can hint at underlying insulin resistance, such as acanthosis, nigricans, skin tags, psoriasis, acne, and hirsutism. More importantly, we've seen how addressing insulin resistance through lifestyle changes like a low glycemic diet and regular exercise can not only improve these skin conditions, but also enhance overall metabolic health. We've learned that while treatments for these conditions can provide relief, addressing the root cause, insulin resistance, can lead to long-lasting improvements. So as we can see, the connection between mental health and insulin resistance is undeniable. Stay healthy, stay mindful, and remember, your health is in your hands. Remember, while skin issues can be frustrating, they often serve as important indicators of our internal health. By addressing insulin resistance, you're not just improving your skin, you're enhancing your overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their health journey. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions should be discussed with a licensed physician or qualified healthcare professional.